Firefighters, paramedics, and emergency medical technicians deal with people with disabilities every day. Every person who suffers a heart attack or other medical emergency or is injured is disabled, at least for a short time. Dealing with people who can't function at full capacity is part of an emergency responder's job. But a certain segment of the population poses special challenges to first responders and demands special knowledge, understanding, and skill. This video is designed to help you, the firefighter or EMS provider, during emergencies involving citizens with permanent disabilities, persons with visual impairments, the deaf and hard of hearing, people with mobility impairments, people with mental illness, and people with cognitive impairments. It will help you learn how to communicate with them, to gain their trust, and to provide the physical help they need. People with disabilities and their loved ones are like everyone else. They're concerned for their safety during an emergency.
Oh, my biggest fears in an emergency situation, that they will forget me. So therefore, I need the necessary information so I can maybe generate enough time so someone can come back and get me. When everybody else is leaving, I want to be in that group as well. So I think it's very important that I have the information, or anybody else with a disability has the information, so we won't be a part of that victim list.
Unfortunately, a majority of those with disabilities say they do not know whom to contact about emergency plans, nor have they made personal plans for emergencies. That means you, the responder, need to be prepared to rescue and protect people with disabilities in accordance with the civil rights statutes, including Section 33 of the Maryland Code and the Federal Americans with Disabilities Act of 1990. Generally, here is what you'll need to prepare for emergencies involving people with disabilities. Familiarize yourself with your responsive area, paying special note to buildings that house persons with disabilities. Participate in emergency planning for people with disabilities before emergencies occur. During a crisis, try to make accommodations that emphasize the disabled person's abilities. Include citizens with disabilities in the decision-making process, including during the emergency itself. These citizens want to be treated as people, not as objects to be dealt with. They have opinions, strengths, and weaknesses, likes and dislikes.
In case there is an emergency and a responder comes, and the trauma of the emergency, first of all, I would like to be treated with respect. That way I can communicate with the responder so he can truly help me. If I have to be standoffish in a situation like that, I may end up getting hurt, and so may the responder. So I think it's imperative that we'll be able to communicate together and understand one another's needs.
The main thing that I really would want firefighters to know about me when they respond, and I've had some experience with this because I often call to do the patient's assist, because there are times where I fall out of my wheelchair and they come in and they have to pick me up and get me in the wheelchair again. And the main thing that I want them to know is really just to ask. Don't be afraid to ask me what is the best way to pick you up, or what is the best way to do something. And I understand, given the time, if it's not a critical emergency where the house is burning down and you need to get me out, but if there's time, my only real advice would be just ask somebody with a disability. A good rule of thumb is to say, okay, ma'am, sir, what is the best way for me to pick you up right now? Because my history and people with disabilities, basically, they know their own bodies. They know what they can and cannot do. And a lot of times, they know the best way to pick them up. Of course, you might think to yourself, well, I know the way I've been trained to pick them up. I'll pick them up like I pick anybody else up. But a person with disability might have some limitations, or they might have some issue where you can't touch a certain part of their body because it's more sensitive. So they might say, hey, it'll be a lot easier on you and a lot easier on me if you just ask me what is the best way to pick me up or get me around. And really that's the main thing that I think firefighters should be really sensitive to.
Beware of treating all people with disabilities the same, even within specific categories of impairment. Great variation exists. People with disabilities are individuals and want to be treated as such. People with visual impairments may be completely blind or have low vision.
We are not a homogeneous group, meaning that there are varying levels of sight impairment, from the least amount to being legally blind, which is 2200, to being significantly blind, or what is commonly known as a low partial, myself, to being totally blind. And as such, there's varying levels of orientation and skills. There's also varying levels of how people approach their blindness in terms of their mobility. Some choose to use canes, and some others use the personal choice of using a guide dog.
It's all right to use the word see, look, or blind when talking to a person who is visually impaired. Announce your presence when you approach, and talk directly to the person with a visual impairment, not to a third party.
I suppose accessibility concern is that blind people not be condescended to or treated as though that they can't be an active part of an emergency or preparing for an emergency.
Offer to let the person grab your arm or shoulder for guidance if he or she wishes. Be sure to mention stairs, doorways, ramps, and other physical obstacles as you move along. Use directional terms such as left, right, and straight ahead. If you are leading several people who are visually impaired at the same time, ask them to hold each other's arms to make sure no one gets left behind. Once you have led them to safety, do not leave them alone in unfamiliar surroundings. After the 1993 World Trade Center bombing, tenants with visual impairments complained that after being escorted from the building, they were left outside in strange surroundings during an ice storm. Make sure that someone stays with the visually impaired person to provide guidance and support. Some people with visual impairments, as well as others with disabilities, depend on guide dogs or other service animals. Guide dogs are not mere pets. They serve as an extension of the person who is visually impaired and must be part of an emergency rescue. Plan to evacuate the service animal with its owner if at all possible.
My concern is that Langer, my service animal, would be injured. My response is always to ensure the safety of Langer as the captain of my guide dog team, and then the safety of myself, and then the safety of my family.
Remember that dogs wearing harnesses are on duty. In most cases, the person who is visually impaired will handle the dog. If you must take control of the dog during a rescue or evacuation, hold it by the leash, not the harness. Do not feed the dog unless asked to do so by the owner. The Baltimore County Fire Department has a program for patients with guide dogs, one of the first of its kind in the nation. In partnership with the Pet ER located at 1209 Cromwell Bridge Road, the fire department will make provisions for a guide dog when the patient is too injured to care for it or if the dog itself is injured. Baltimore County first responders should familiarize themselves with this program. Hearing impairments range from mild hearing loss to profound hearing loss. Some who are deaf or hard of hearing can use their residual hearing with help from hearing aids and lip reading, while others use sign language. Some welcome the offer of a pencil and paper so they can communicate with you that way, but others may not be comfortable with this. Your job is to identify the best way to communicate with the person.
I think the first thing, for somebody who's hard of hearing, it's a matter of knowing that they may not catch everything you say the first time you say it. During an emergency, they're going to be nervous and upset anyway. So it's a matter of being patient. I think that's the biggest thing, is to be patient with people and understanding that they may be trying to be cooperative, but they may not because they don't understand what you're saying.
Some deaf people have a hard time writing. They're just not skilled with English. Some, it's like a foreign language to them. Some deaf people can write, but they really prefer sign language rather than trying to write things back and forth. And I think the fire department people, if they learn sign language, I think they should, because it would be much easier to communicate with deaf people much faster than by writing. And some deaf people are not very good at lip reading. Some deaf people can lip read, but some can't.
If a person who is deaf or hard of hearing cannot see you as you approach, flick the lights on and off if possible to let them know you are here. The speech of people who are deaf or hard of hearing can be difficult to understand. It's okay to ask the person to repeat something if you're not able to understand the first time, and you should be ready to repeat things to help the communication process. Face the light. Keep your face visible to the person. Never chew gum. It interferes with lip reading. Establish eye contact and continue to look and talk directly to the person who is deaf or hard of hearing, even if an interpreter is present. Use facial expressions and hand gestures as cues.
My biggest fear about an emergency is not understanding what's going on. Because I'm hard of hearing, I may not get the information that I was looking for. It may be a rush situation. People may be yelling, and yelling will not make it be possible for me to hear at all. Emergency also have lots of noise around them. I'll be concerned that I won't know what's happening and that I won't know what to do.
At night while outdoors or in other low light conditions, it may be helpful to provide persons who are deaf or hard of hearing with a flashlight so they can signal their locations and to facilitate lip reading. People with developmental disabilities may have limited cognitive, motor, and social abilities. They may have trouble recognizing rescuers, responding to instructions, or being motivated to respond during a crisis. Be patient. Break down info into simple steps. You may want to try using simple signals or symbols. Sometimes pictures or diagrams work well for people who are developmentally disabled. Be extremely careful not to talk about a person to others in front of him or her. Do not treat adults with cognitive disabilities as if they are children. Do not talk down to them. They are adults who happen to have a disability.
Hi, I'm Doris Rowe. I'm from the Arc of Baltimore. They have to listen what I have to say, like if I'm allergic to medicine or if I'm important. I'm very important. Like everybody else, I'm very important. I should have the rights for the same as everybody else.
Hi, I'm Linda Pearl. My daughter Robin has an autism spectrum disorder. Autism is a communication disorder. People on the autism spectrum, especially if they're nervous, may have a lot of trouble responding to questions. What you would normally do would be to ask someone again or to ask it in another way, but that might be more confusing. Often it's better to just give a person simple directions and tell them what they need to do.
It might take me time to answer questions.
First of all, a person with autism may not show if they are in pain. Secondly, when a person is asked a question such as, did you hurt your arm or your leg? They may either repeat the whole question or they may just say the last two words that they were able to process. So they may respond, your leg, when in fact their arm was hurt as well.
Mental illness is an invisible disability. There are many kinds of mental illnesses, and